We're going to do a quick demo for the brachialis muscle. Brachialis is an elbow flexor. It is deep to the biceps brachii. It is innervated by the musculocutaneous nerve and a small amount from the radial nerve. There's a branch on this lateral side. We are going to be needling it two different ways. We're going to be thinking about trying to get around or through biceps brachii, remembering that brachialis originating on the distal anterior humerus, about the distal 1/2, and inserting on the ulnar coronoid process and the ulnar tuberosity, essentially deep to pericardium 3 here. This is a prime mover for elbow flexion and is commonly injured in that. The biceps on top here gets a lot of the attention because it is superficial and sort of visual, but brachialis is an important muscle for elbow flexion. Characteristically, people will have deep, achy pain at the cubital crease when they have injured the brachialis or have trigger points in it. So the first thing we're going to do is think about grasping the biceps brachii, and we're going to deviate it or displace it medially, and then using our middle ring and index fingers, press back into the anterior aspect of the humerus. And I can strum this guy and feel, especially right in here, a nice tight bundle. You can see it when I strum across it. So that's what we're going to aim for to needle. But you can actually stim it with a stimulator directly and get it to contract. I don't know if that shows up well right there. So you don't necessarily need to stim it, but you can, and it will look different than the bicep itself contracting, which we can see here. So got a needle here. Do this all with my non-dominant hand. We're going to just, again, drag the bicep medially, and we're going to aim directly towards that anterior surface of the humerus. There'll be some skin pull. So I have the humerus as a bony backdrop, and then I can just stim this here, and you'll see that contraction like that. This needle is touching the bone. It's touching the humerus. It's a 50 millimeter needle. The other approach to needling brachialis is to go directly between the heads of the biceps muscle. So I can press in and feel for that cleft, and I can place the needle directly in it. And again, I'm going to be aiming straight back for the head of the humerus. And I'm just going to slowly advance the needle. I'm going nice and slow, and I'm paying attention to feedback. I don't want any sharp sensations. That means I'm close to vasculature. And I don't want burny or electric sensations, which mean I'm close to a nerve. I'm okay with a deep, achy, kind of Dutchy sensation. That means I'm in the muscle belly, and that's what we're going for. So I will stim this guy here. And you'll see that contraction there as well, like that. You can tell we're getting a brachialis contraction because if I pronate my forearm, I'm not getting any supination of the forearm. Brachialis is only an elbow mover. It is a uni-articulate muscle, as opposed to the biceps,